So I'll start with where we are with COVID right now, which is that we are better, actually pretty significantly better than we were last week. This morning, we're showing 865 hospitalizations. That compares to 968 last week, which is a 12% decline. And also a pretty significant change from what the average was a month ago, which was 1,087 was the average over the last month. So we're really pleased to be going down. In addition, we're seeing a decline of people on ventilators. We now have 120 patients on ventilators, which is a 29% decline in the last week. I want to remind folks that that decline is both from people getting better and leaving, and also from people dying. We continue to have 10 to 15 people die in the hospital across the state every day from COVID. This morning, I was out walking my dog and feeling frustrated by this number of 10 to 15 people dying, and feeling like we're sort of accepting that as a society in a way that I really think is bad. And I decided to look up how many people died in the duck boat accident. And there were 5 students that were killed in the duck boat accident, 70 people injured. That's what I could find in the news reporting anyway. And that caused just massive change and a shutdown of the duck boats, and huge reconsideration of transportation systems. And we have 2 to 3 times that many people dying every day. And so really encourage people to continue to do the things that keep them and their community safe: getting vaccinated, wearing their masks, wearing a good mask. I think Dr. Jeff Duchin from the Seattle Health Department makes a very compelling case about it's time for a better mask, with surgical masks and N95s and KN95s being pretty widely available, that moving away from the cloth masks to the more effective masks is really worthwhile, and not really keeping your distance from folks who aren't vaccinated. We also know, we're watching with concern, I think Dr. Cohen may speak about this as well, our colleagues in the Northeast and the Midwest seeing a pretty significant growth in COVID cases. I've heard from my counterparts in Missouri, Connecticut, New Jersey over the last week, especially over the weekend, feeling like, oh my goodness, this is getting bad again. So that really got my attention, to be hearing that from other parts of the country. And so we don't want to be in that position. We do not want to be in one of those states that's in that, is it getting bad again? But their numbers have gone up pretty significantly in the last few weeks. Vaccines are widely available. It can take a little bit of work to get a kid vaccine. I did get my 10-year-old son his first shot. I woke up at 3 in the morning, just kind of naturally woke up and was like, maybe there's some slots have been added. So I actually did find a slot at 3 in the morning, which might make me sound a little crazy, but we went to Walgreens and had a lovely time, and I'm very happy to get that. I think I saw this weekend, the Seattle Public Schools, which I've got kids in, was sharing that they had more vaccine available than they had anticipated, and they had some spaces available for walk-ins when in their prior week's clinics they hadn't. So seems like maybe the first week was pretty tight, but hopefully next week and the week after there'll be a lot more space for the 5 to 11s, and really encourage people to get those kids vaccinated, especially as the holidays come along, that they can have the best chance possible of not spreading this disease to anyone in their family. We're also very interested in encouraging people who are eligible for boosters to get booster shots, to get them. We do see some signs of waning immunity, as happens with many vaccines. And so really encourage folks to be seeking out their booster shots. Originally, as you know, only the Pfizer folks were eligible for boosters. I, for example, have Moderna. There was no booster available. Now there is boosters available for anyone who got Pfizer, Moderna, or J&J. All 3 have boosters available. So very, very much encourage people to seek those out. I also want to share we do have the updated data about hospital staff vaccinations. So about 94% of hospital staff statewide are fully vaccinated, or got fully vaccinated. We lost about 2% of staff, and the remaining staff have sought and received an exemption and have been accommodated or are in process of getting vaccinated right now. So that's better than we thought. It's higher in urban areas than in rural areas. So it remains, in some rural communities, this remains an issue of vaccinations. We see that services are still constrained in some communities from the mandate and from a number of other issues, including, just like, is there enough childcare? Are people burned out? the staffing agencies, people who wanted to avoid the mandate leaving for other states. The federal vaccine mandate goes into effect January the 4th. That will make Washington be in line with all the other states in the country. We were concerned about that when people just who didn't want to get vaccinated just leave Washington and go elsewhere. I think they have, but that time window is not very long before, in order to work in healthcare, you have to be vaccinated. And so that gets to my final point, which is that hospitals are very concerned about staffing and doing a lot of work to retain staff. They're offering incentive bonuses and retention bonuses and posting as many jobs as they possibly can, heavy recruitment, working with staffing agencies, really trying to retain the staff they have and get more staff. We're very pleased to be starting conversations with the state legislature and the governor's office about significant investments in workforce, especially in the healthcare area. And I think there's some real promising possibilities here for expanding training slots. We continue in our state to turn away hundreds or maybe thousands of qualified applicants to healthcare programs for lack of space. So we're excited that this may be a silver lining of COVID is increased attention from the state on workforce training in the healthcare field.